Pakistan's 2010 floods have been unprecedented and devastating. Stretching from the country's north to south, the deluge has affected some 20 million people and put their lives and health at risk. WHO, working closely with the Ministry of Health, was part of the first wave of response to the crisis. WHO quickly deployed staff, experts, and partners from across the world to strengthen the health response. WHO's response was built on 3 pillars: coordination and information management, control of infections and communicable diseases, primary health care delivery. It is crucial to gather and assess information on health needs and gaps in order to respond effectively. WHO coordinates health cluster partners who are delivering routine care and responding to the multiple health challenges, ranging from communicable diseases to disruption in routine health care, such as the safe delivery of babies. The Strategic Health Operations Center allows us to communicate with staff and partners in the field and around the world, enabling us to update health information as the emergency evolves. 6 health response hubs have been set up in Islamabad, Peshawar, Quetta, Multan, Sukkur, and Hyderabad. WHO is working with the Ministry of Health and other humanitarian partners to provide public health and health emergency response expertise, monitor health needs and evaluate the health response, plan effective health interventions for the immediate and medium term, and geographical mapping and health information. Because of increased risks of water and vector-borne diseases like diarrhea and malaria, the disease early warning system has been established in affected areas. Water quality is tested and improved in health facilities and temporary settlements. To respond to the malaria threat, tens of thousands of treated bed nets and rapid diagnostic kits have been sent to affected areas to prevent illness and diagnose cases. WHO and Pakistani authorities have established mobile health education teams in each province. Dozens of new diarrhea treatment centers have been set up, supporting clinics and hospitals that have already treated over 900,000 people for diarrheal diseases. Experts from the International Center for Diarrhea Disease Research in Bangladesh and the U.S. Centers for Disease Control, Atlanta, are helping control disease and train health response teams. More than 400 of the almost 3,000 healthcare centers in flood-affected areas were damaged or destroyed by the floods. Working with cluster partners and health authorities, it is WHO's priority to rebuild these centers and restore routine care, including reproductive health services. The gaps in health services must be filled while the rebuilding takes place. WHO, the government, and partners are ensuring primary health care is delivered. Almost 6 million people have received care in the first 50 days. Over 2,000 mobile and fixed medical teams are operating in affected areas, run by government, NGOs, and UN agencies. More than 1,000 metric tons of medicines and supplies have been provided to health response teams and agencies. This national and global response is working and evolving. The cross-sectional activities targeting health, nutrition, and water and sanitation have been intensified. The Joint Survival Strategy has brought UNICEF, the World Food Programme, and WHO together to tackle the threats posed by poor hygiene and sanitation, lack of food, and their impact on health care. Information is flowing faster. Supplies and manpower are arriving. More and more people are being treated and receiving care. But as the waters recede, new challenges will emerge. WHO and its many partners will keep helping the people of Pakistan to recover from the impact of this disaster. To that end, health services must be built back stronger than before, so survivors can rebuild their lives, have access to better care, and protect their health.